Okay, so we're going to look at protocols that are pretty much standard in the healthcare field that every new healthcare professional should be aware of. Remember why you are here. It's great to be a healthcare professional. There's a lot of prestige that comes with the job, but keep in mind the real reason that you choose this profession. It was to help people, right? So the most important priority should always be your patient. They are the reasons you have a job. So let's not forget that. So we need to look at what is acceptable communication. And I'm sure you've communicated with friends and family before and ask yourself this question: is that the same kind of communication that you would use with a complete stranger or someone who is ill? So the type of communication that we use in the healthcare field is what we call therapeutic communication, and these are just some examples of such. So always greet your patients with a smile, introduce yourself, state your first name, last name, and job title, and inquire respectfully how they would prefer to be addressed. You just don't call someone grandma or hey you or Ed or Fred. I mean, everyone has a particular way that they prefer to be addressed, and you are not their family. So you need to respect that in kind. You need to ask permission to do your job, even if you're getting paid for it. Just because your supervisor tells you to go to a patient's room to perform a procedure doesn't mean you can if when you ask the patient if you can perform a procedure, they say no. No means no. Everyone has the right to say no. The patient at the end of the day is your boss. Remember, if there were no patients, you would not have a job. So no means no. You have to ask the patient if you can perform a procedure and always explain it to them. They may say yes, but once you explain it, they'll say, oh, heck no, I don't want you to do that. So what happens if they do say no? Well, don't freak out. It happens all the time. They could just be having a bad day. They could be in a lot of pain. There could be numerous factors. Maybe they had a very rude healthcare provider that came in the room before you. Don't stand there and try to convince them for fear that your supervisor is going to reprimand you. Respect their wishes and document it in their electronic medical records that the patient stated they did not want the procedure done. Then inform your supervisor. And will your supervisor be upset? Yeah, maybe, because supervisors aren't always the best healthcare professionals. No offense to supervisors out there. But you must remember whose needs come first, and that would be your patients. You need to be receptive. So active listening is, looking at the patient, letting them speak, being patient, nodding your head, never putting your hands on your hips or looking anxious like you've got 500 other patients you have to take care of, which you may. I exaggerate, but working as a healthcare provider can be very stressful, and we have to know how to manage our emotions. One of the techniques that I use is when I feel overwhelmed, overstressed, overworked, when I go into a patient's room, I'm just going to shut the door. I'm going to take a deep breath and I'm going to say the only person that exists in this world right now is my patient right in front of me. And I'm going to relax and take my time and help them do whatever it is that they need and not appear to them that I'm feeling rushed. Be alert to body language. You can tell if a patient needs help or is not feeling well by observing their body language and facial expressions. And don't be afraid to ask. It can get pretty crazy in a hospital or in an outpatient setting. Keep in mind your patients often feel alone and isolated. Always stop and ask how they're doing. It means a lot. Be prepared to act. If a patient requests your help, you must help them. However, you must follow the chain of command and not do something, even if it's helping the patient, but it's out of the scope of your practice. So for instance, you're a phlebotomist, someone needs to get off the bedpan. Or let's say you're an EKG tech. You may know how to take them off the bedpan, but that may be the job of a nurse's aide or a nurse. So stay with them, pull their screen, give them privacy, put their call light on, and explain to them that you're going to go get the nurse and or nurse aide If you can't bring the nurse or nurse aide to the room immediately, go back to the patient and tell them that you have informed them and they had given you some type of time frame when they're going to be in the room. So what's your scope of practice? Well, it just depends on what you do. Just because you're a phlebotomist doesn't mean you can draw from a carotid artery. Obviously, that's an artery, not a vein. It doesn't give you the right to do sutures or draw from a leg. You can't stick that needle anywhere, just like someone who's starting an IV. Everyone has their scope of practice. So, if you're walking down the hall and someone calls out to you, yeah, that means you. Go in and help them, okay? Help them to the best of your ability within the scope of your practice. If it's something you can't do, let the patient know you're going to go get someone that can help. Make sure you come back and let them know you notified that person and provide a time frame. Find out what it is they need. It might be simple as getting them a blanket or moving their breakfast tray to their bedside. You can do that. That's not off limits. That's everybody's job. If it's serious, then, if they're having a short of breath, hard time breathing, then what you're going to do is pull the call light right out of the wall. And that's going to just alert everybody on the floor. Or, dial 911 for code blue, or just call a code blue, or have the operator call a code blue while you're in the room with them. Never leave someone if you know it's a ominous circumstance, that they're gasping for breath, they're short of breath. If you find that they're not responsive, just right into CPR. What happens if they code? Well, stay in the code with the code team. So if the whole code team comes in, you don't leave and go about your merry way. You stay. That's the rule. No matter what your job title. You can be housekeeping, you can be a nurse's aide. Everybody stays for a code. And when the patient codes, it means their heart stops or they stop breathing. Charting. Why must I chart? Well, if it isn't charted, then you didn't do it. You're going to see this phrase all over your course. You chart after every procedure. Start off with the time, usually in military hours, such as 1400 is 2 p.m. Your initials, your title. Never use the patient's name. Rather use the abbreviation patient. Only chart the facts, not your emotions, what you think. Don't get colorful. Don't write a book. Use proper medical terminology and get straight to the point. Don't tell patients their lab results. Unless you're a physician, I'm going to stop you right here. Unless you're a physician, a nurse practitioner, or a physician's assistant, and you're authorized, typically only a physician has the authority to give a patient their results. Tell them what their PT is, what their hemoglobin is, what their CT scan says. You're opening up a can of worms if you try to give people their results, because the next thing you're going to say is, what does that mean? Well, are you going to interpret what that means? If the CT scan says possible thymic mass on the in the mediastinum, are you going to say, oh, well, you have a thymic mass according to this on the mediastinum? That could be anything from cancer to myasthenia gravis. Also, you can't take a verbal doctor's order. And doctors are notorious for shouting orders to whomever is going to listen to them. Only nurses can do this. And you can't provide medical advice. So no matter how much you know and how confident you are, it's great, okay, but be aware that you don't have those credentials to be able to take a verbal doctor's order or give medical advice. Even if your whole family, an extended family, looks to you and calls you in the middle of the night, little Jamie stubbed their toe, it's bleeding really bad, what do I do? That's up to you. But when you're dealing with patients, it's a very sensitive matter. It's a very sensitive subject. You don't have an extensive understanding of the patient's chart, so don't even go there. Uphold veracity and beneficence. What does that mean? Veracity is truthfulness. Beneficence is kindness and compassion. Always tell the truth. Nobody likes a liar, especially patients, and if you make a mistake, own up to it. The worst thing you can do is lie about it, get caught in the lie, and then you just, you can't even hold your head up. If you don't know something, go get the answer. You may be the only person who can reach out to the doctor or lab to get an answer for your patient. If not, find someone who can. And always be kind to others, not just in your job, but in everything you do on a daily basis. You'll like yourself more. Always be ready to help. Offering a helping hand is part and parcel of a healthcare provider. Don't be afraid to work. Be there for your fellow staff. There's always work to do. You have a profession, okay? It's not just a job. It means that if you're clocked out and you're tired and your legs are aching and you just can't wait to go home and veg on the couch, too bad. Until you walk through those doors and you get into the sanctity of your car, if you have, that going on, if someone comes up to you and says, "My dear, can you direct me to OR? My husband is having surgery." Guess what? You're it. You're going to have to help that lady, get her a wheelchair, take her all the way to OR waiting room. And you're not getting paid for that. Also, don't be afraid to learn something new. Technology is always changing. Most of the time when you get a certification from a technical school in phlebotomy, medical assistant, there's always continuing education credits to earn on a regular basis. So keep on top of things. Be prepared to act, know your limitations, and know who your leads are when you have questions. In summary, having a profession in the medical field can be very rewarding. Knowing your job and your scope of practice will make you a better healthcare provider. Always stay up to date on technology. Many facilities will have continuing education requirements. And remember that your main priority is your patient. Promoting their welfare and well-being is a measurement of your success as a healthcare provider.